Senator Di Natale.
Thank you, Madam Acting Deputy President. I rise today to speak in favour of the Tobacco Plain Packaging Bill 2011. Now, in this building we have many disagreements. In fact, we've just seen only very recently, earlier today in fact, an hour of bile, of nasty invective from people on that side of the chamber. But I am sure that there's one thing that we can all agree on, and that is the importance of improving the health of Australian citizens. The Greens believe that this bill will improve people's health. It will mean that less people smoke, and for that reason we are very pleased to support the government on this important reform, and we stand behind it. I'm very pleased to also have the opportunity to speak to this bill because I know of what it will mean for the lives of ordinary Australians. Before entering politics, I spent my professional life as a GP and later as a public health specialist. As a former clinician, I understand very well the impact that this bill will have on the lives of ordinary people. I've been with patients as they struggle to come to terms with being given a diagnosis, a fatal diagnosis of lung cancer. I've seen the look in their eyes that dawns on them that they have days or months left on this planet. I've been with them as they lose weight, as they struggle for breath, as they lie in excruciating pain. It's a death you would not wish on your worst enemy. And sadly, it's an experience that is all too common. Indeed, I suspect there are many people here in this chamber who have lost friends and family to tobacco-related illness. And with every life lost, there are many other lives that are affected. Parents leave behind young kids, adults leave behind grieving partners, and families are shattered. Now, if we can spare them this misery, then nothing should stand in our way. I'm also aware of the impact that the damage from tobacco has at a population level, and the statistics on this are alarming. Almost a third of adult males still smoke worldwide, and we know that smoking will kill half of them. Around the world, 150 people will die from smoking while I deliver this speech. More than 500,000 non-smokers will die this year just from exposure to other people's smoke. Smoking globally is on the rise, and every week enough young people around the world start smoking to fill the city of Canberra twice over. In our own part of the world, a quarter of young people in the Western Pacific region will die from tobacco use. Despite some progress here at home, the situation is still very serious. 1 in 6 Australians still smoke, and each year around 15,000 Australians die from tobacco-related illnesses. Improving the health of the Australian community is reason enough to act, but reducing the consumption of tobacco, which this bill will do, makes sense also for our bottom line. The economic costs of tobacco addiction are estimated at over $31 billion each year, which is more than half of the total health budget and 50% more than the entire defence budget. It's a staggering sum of money. And if we could divert just a fraction of those costs to the economy, we would inject billions more into our nation's schools, into our nation's hospitals, and we'd still have money to spare. As it is, we currently pay for 750,000 hospital bed days each year, and $600 million is spent by our hospitals directly on treatment of these diseases. It's one bill we should not have to pay. Tobacco is the leading cause of preventable death and illness. The costs are huge. It's an enormous burden on our nation's health system, and no government should sit on its hands on this issue. Now, thankfully, the debate around tobacco has shifted considerably since the 1940s, when 3 out of every 4 adults smoked. During the war, charities sent cigarettes to the front line and people actually apologised for not smoking. My partner Lucy tells me a story about her grandmother who would blow smoke up all the kids' sleeves and they'd laugh at it. Since the US Surgeon General's landmark report in 1964, however, the global debate around smoking has changed, and it's changed for the better. We've seen changes around the world, including government-funded anti-smoking campaigns. We've seen price used as a mechanism, so higher taxes on cigarettes to provide incentives to help people quit. In many countries, we've seen smoking phased out of workplaces. We've seen it phased out of cinemas, on planes, in restaurants, and most recently we've seen the introduction, particularly here in Australia, of graphic warning labels. And now we're looking at outdoor smoking bans in many places. While we do have many disagreements in this place, it's important to put on the record that the Greens want to give credit to the current government for taking significant and courageous action to combat this problem. The National Partnership Agreement on Preventative Health at COAG, the Preventative Health Task Force, the establishment of the Australian National Preventative Health Agency. They have all been very positive initiatives. And not surprisingly, each of them has tobacco control at the top of their agenda. The target of reducing tobacco addiction to 10% by 2018 is to be supported. Unfortunately, there is a profitable, transnational industry that stands in the way of this reform. The few multinational tobacco conglomerates that control this deadly trade sell more than 10 million cigarettes a minute around the world. And while sales might be declining here, they're booming in many low-income countries. Tobacco companies are now aggressively targeting emerging markets around the world in order to compensate for their declining sales in countries like Australia. Unfortunately, while the people that use its products suffer, the industry itself is in very good shape. And its deep pockets mean that the industry has been able to spend millions fighting advances in tobacco control over recent decades. They might not be able to hide from the gruesome body count that their industry extracts, but they do delay, they obfuscate and they lie. We know from past reforms that any effort to control tobacco will be attacked from all conceivable direction. The industry's got a track record of burying evidence and shredding documents that highlight the dangers of smoking. We see public relations campaigns designed to outrage the smoking public. We get so-called experts produced on demand. They manufacture controversy, they muddy the evidence, and it doesn't matter how clear the facts are, they will stop at nothing to prevent tobacco reform. We see front groups springing up in order to support their agenda. And for example, the Alliance of Australian Retailers has been telling the Australian public that it's a bill that will hurt small retailers. This despite the fact, the clear evidence published in the British Medical Journal that shows very elegantly that plain packaging, and I quote, will, if anything, modestly decrease transaction times and selection errors. We're now seeing Philip Morris exploit a free trade agreement between Hong Kong and Australia in its new front on fighting this important reform. And the industry doesn't just stop there. It has another weapon in its arsenal, and that is its donations to political parties. Unfortunately, the tobacco industry still does have some clout in this country. The Australian Greens don't support donations from big tobacco, and albeit belatedly in 2004, the Australian Labor Party stopped accepting such donations. However, the Liberal and National parties continue to accept hundreds of thousands of dollars in industry donations each year. And I heard Senator Fierravanti-Wells recently criticise the Health Minister for her past dealings with big tobacco, but that criticism rings hollow while the coalition continue to benefit from the largesse of this obnoxious and despicable industry. I have to say there is an area where the current government does merit some criticism, and that is in the area of the Future Fund. The Future Fund has $150 million of Australian taxpayer funds invested in big tobacco, $46 million through British American Tobacco, $36 million in New York-based Philip Morris, $26 million in Lorillard Inc. as of the end of last year. All this at a time when we're trying to break the hold of big tobacco. And it's remarkable that the federal government hasn't stepped in to ensure that its own important reforms on tobacco control aren't matched by its policy on the Future Fund. Now on to the details of this bill. It is a bill that is the latest strike in the fight against tobacco-related illness. We are on the forefront of reform when it comes to tobacco control in this area. We in Australia have strict regulation which prevents the advertising of tobacco products to new customers, but the one frontier that has remained open to the tobacco industry is on the packet themselves. They're a little billboard of nastiness advertising their wares to passers-by from pockets, from kitchen tables, on dashboards of cars all around the country. And smokers do see the branding on this packet potentially dozens of times a day. And this bill will remove that opportunity, an opportunity for tobacco companies to compete on the grounds of brand awareness and image. The Tobacco Plain Packaging Act 2011, when it does come into law, will remove the ability of tobacco manufacturers to display logos, images and promotional text on their packs, and it will replace it all with the plain brown packet. Current health warnings will be enlarged and accentuated. So all that will remain to the would-be tobacco marketer is the brand name and the variant placed on the back on the packet in a standard position in standard font. Under the Act, it will be an offence to sell a non-compliant product with potential penalties in excess of $1 million for a willful breach of the Act by a body corporate. Under the Act, the packet will be tightly controlled. They have to be made of cardboard, packs have to be rectangular, contain no embossing. The colour, as I said, needs to be a drab dark brown, and no trademarks will be allowed. The location and orientation of the brand and variant name are strictly prescribed, and the graphic warning will be enlarged to 70% of the front of the packet. In short, this bill aims to ensure that the packet of cigarettes is as ugly as the product itself. And it's not just action for the sake of acting. There is very good evidence that this bill will save lives. While it's true that Australia will be leading the world with this initiative, studies from around the world do indicate that this reform will work. There are dozens of scientific papers that support this proposal. They indicate that plain packaging will work because it reduces the attractiveness of the product, especially to young people. It also erodes brand loyalty and makes it more difficult for tobacco companies to mislead consumers by pretending that one type of cigarette is less deadly than another. In addition, studies have found that plain packaging significantly improves the recall of the health warnings on packets. Just that one little extra reminder that smoking could kill you will be enough to help many Australians over the line to a tobacco-free life. I'm glad to say that support from the public health community has been overwhelming, as it should be. The National Preventative Health Task Force was unequivocal in its endorsement of plain packaging. The World Health Organization Framework Convention on Tobacco Control also recommends this reform as an aspect on tobacco advertising bans. Now, as the first signatory to the framework, it's appropriate that we're the first parliament in the world to tackle this issue. We are at the forefront of change here. It's a change that's necessary, that's long overdue, and again, I say the government should be congratulated for its bravery on this issue. And we've got one more reason to know that this reform will work, and that's the hysterical reaction of the industry itself. We know that they too are aware of the evidence, even as they seek to dismiss it. If they genuinely believe that this was a reform that would not cost them customers, they'd be a little more relaxed about it. Instead, they're fighting this war on all fronts, including the threat of action in the High Court. Now, I'm not a lawyer. Many of the objections are of a legal and a constitutional nature. I won't pretend to be able to give thorough legal advice, but I will say that a number of disinterested legal scholars have been very clear in their view that the claims made by the tobacco industry are not valid. The industry also claims that plain packaging will create an explosion in the illicit and counterfeit tobacco smuggling market. According to the industry, more people are going to smoke lower quality products. We're going to lose excise and customs revenue, and it's going to be a huge threat to the Australian community. Now, of course, illicit tobacco is something we should take seriously. Users of the products do undermine the controls that we do have in place. But like with many of the warnings of the tobacco industry, we should take it with a degree of scepticism. We know that there are ways of dealing with these claims, and in any case, they've been debunked by experts in many, many different areas. There's been another threat by the industry, and that is the threat of deep discounting of cigarettes. That once plain packaging's been removed, that they'll lose the ability to compete on the basis of trademark, and therefore they'll compete on the basis of price. But the industry's already admitted, in questionings in a Senate committee hearing, that this is something that could easily be dealt with by administering a minimum price on tobacco products. Look, I think it's a hollow threat, but in any case, I have to say we welcome that fight. This bill is not the end of the road when it comes to tobacco control. There's much more to be done. We can do more in terms of raising awareness. We can do more in terms of regulating the contents of cigarettes. We can do more in terms of our investment, as I said earlier, in the tobacco industry through the Future Fund. The Greens are also calling for an end to duty-free cigarettes, for example, at airports. But the reality is that tomorrow and the next day and the day after that, a young person will be offered a cigarette for the very first time. Whether they refuse or whether they reach for that first cigarette might determine the course of their life. It could mean that they don't live to see their child graduate from university. It could be the difference between enjoying a well-deserved retirement with their family or spending the last days of their life gasping for breath in a hospital bed at the age of 50. There are a lot of factors that will influence that first decision. What a child sees in their home, what their friends think, how their body responds to that first puff of that first cigarette. And we know that legislation might not be able to change some of these factors. But one important factor remains, and it's how a young person perceives that product. Is it cool? Is it dangerous? The fact that branding legitimises cigarette smoking means that a lot of people earn a great deal of money maximising that impact. There's an entire branch of psychology devoted to studying it, and marketers do their best to exploit it. So in that split second, the difference between a recognisable blue logo and a plain, drab, brown pack of cigarettes adorned with a photo of a diseased organ could be crucial in that person's decision about whether to smoke or not. That, on its own, is reason enough to support this bill, and once again I say I'm very, very pleased to be able to support it, and I commend it to the Senate.